teachers, especially Dr. Anjaneyamurthy sir. So a warm welcome to all of you and a warm good afternoon. So I'll be presenting a paper on need for standardization of treatment approaches in Ayurveda. Of course, this is just not related with what you have been hearing for all this time. So this is not directly related with this is not actually related with Ayurveda and integrative medicine, but I think that I feel that this is the need. If we have to go globally, if we have to integrate the medicines, so one of the very important things to do is to arrive at a standardization. Because why there is a need for standardization in Ayurveda, especially the treatment protocols or the treatment approaches in Ayurveda, is because why we need to standardize the treatment approaches. So this is one of the important things which we need to answer. So there is a need for standardization because Ayurveda has the driver's method of treatment approaches. So you take any disease, for example, you take Atisara or you take Grahani or you take osteoarthritis or whatever the disease. So the treatment approach of one doctor differs from the other. So this is one of the things, and this is one of the issues which calls for a need for standardization of the treatment protocols in Ayurveda. But it is not so easy, so there are several challenges which are associated with it. So I will be speaking about challenges as well as the need for standardization. So what do you understand by standardization? So standardization is the process of developing and agreeing upon technical standards. We have to develop about technical standards. For example, if there is a disease, so we need to understand about the technicalities of the disease. So what is the disease about? So what does it explain and what to expect out of it and how to examine it in the perspective of treatment. So when you are treating a case, so what are the things you need to know about the disease? What are the standards of it? For example, just defining what the disease is. So if you take for example a disease like Grahani, so if you have to standardize just Grahani, so it is important to arrive at a definition first. So you have so many texts defining various forms, and this gives a lot of ambiguity. So that is why it is necessary for us to identify what is Grahani is, what is the exact definition of it, to standardize it and to understand. So because without defining, you cannot go to the next step of understanding it, and without understanding, you cannot communicate. So the communication in the sense of reporting. So if you have to arrive at EBM, what we call evidence-based medicine, so one of the very important things is to standardize a particular treatment protocol. So this is the need of the hour. So if you have to go globally, so what you need to do is you have to understand yourself. So that is defining of the disease. Whatever the disease is, you have to understand yourself, define how it could be understood and how it could be made understandable to others. So this is very, very important. So when you go for standardization, it establishes technical specifications for a particular disease or a particular treatment protocol, the criteria, the methods, the processes, practices, and so on. And what is the concept? What is the concept of standardization of treatment protocols in Ayurveda? So to say it is just evolving, because if you see, there are many people who are reluctant for the standardization of these protocols, especially the treatment protocols, as I told you. Because if you go from North India to South India, or elsewhere, or in just one state, or in just one institution, so there is a large amount of difference between the practice of Ayurveda. If I agree on something, another person may not agree on the same thing. So there is a lot of diverse attitudes and diverse approaches in Ayurveda. So that is why the concept is still evolving. So what you mean by standardization, that you have to explain. So standardization does not create watertight compartments. So one of the fears, even the modern doctors, it is not only confined to Ayurveda, even the modern doctors have this approach or the mindset that standardization creates watertight compartments. Watertight compartments in the sense, like if it's osteoarthritis, you go for only Simhanada Gugulu or Mahayogaraja Gugulu. So it is not so. So standardization does not explain or does not tell you that you have to use this, you have to use that in a particular condition. Standardization means it gives you a broad broad idea of how to approach to the disease. What are the principles that has to be adopted? So this is standardization, and a proper standardization will give you proper ideas about how to proceed with a particular disease or a particular condition. So it involves basically two steps, basically the analysis of the data generated by EVM. So what evidence-based medicine is. So it does not, your EVM is your Charaka text, your Sushruta and everything. So whatever the data you are collecting from those things, you try it out, you come up with certain documentation and you document it and you analyze it in a retrograde way. So that is the first step. And next is creation of protocol guided treatment based on these things. So based on the documentation, first what you do, you are going to arrive at a protocol, and this protocol should be peer reviewed. So you can go from anywhere to everywhere and seek opinions of scholars and take opinions by books and everything, and you have to arrive at a consensus and create a protocol which can suggest you to do the best treatment, because evidence-based medicine, the intention of doing it is to provide the best service, and the quality of the service will be great by standardization. And as I told you, what is the need? It improves the quality of healthcare delivery. Whatever healthcare you are giving, unless and until it is of a particular standard or a particular quality, so it will not be accepted by the community. It is not just the international community, but the national community or the local community also does not accept if it is not standardized, because this is the age of standardization. So it helps in clearly defining, understanding, reporting, assessing and applying medical skills. So which is very, very important. It's not only important to define, it is to understand, it is to report. So if you are not reporting to the community, so community will not accept it. So that is one of the needs of why we have to do it, and assess and apply the medical skills. And it is also very important socio-economically. We also speak, for example, if you take about why the medicine is not reaching in the Western countries or the European countries. So why it happens? So because it is not covered with the insurance. So when the matter of insurance comes, insurance people always need something of a sort called standardization. If your treatment protocols are not standard, if it is not standardized, because the insurance companies need those standardization so that they can allocate certain amount of money to certain diseases. For example, if a person is suffering from osteoarthritis, so what has to be done? So what is the treatment protocol? What is the standard treatment protocol? How to fix the rates? And all these things depends upon the standard treatment protocol. The insurance company cannot rely that this doctor will charge you 5,000 rupees, this doctor will charge you 8,000 rupees. It is not so. So if you have a set of standard protocols, the insurance companies also will come forward to fix up a certain money and it will endorse it. And also it enriches the evidence base of Ayurveda. So I think there are a lot of challenges which I wanted to speak, but due to lack of time I am not able to do it. So the conclusion is, in spite of the challenges, standardization is necessary. It's time we move from intuition-based practice to evidence-based practice, because with intuition you cannot treat a patient. So it is only on evidence-based. Although this science has come through intuition, it is important to form evidence-based and will always remain, although there is standardization, so it has to remain a human process. That is, the human touch will also be an integral part of it. My acknowledgements, and thank you for taking